Hi, this is Searcher in Charge. We're here to help you find quality answers to your questions. This is video 5 in our series of videos that help you find quality health information. In this video, we will continue learning how to analyze the information we find and be our own searcher in charge of finding quality answers to important health questions. Our goal is to learn how to find quality health information and discuss it with our healthcare professional if important. Today, we are going to look at 2 web pages and analyze the quality of the content so we can learn to do this on our own. If you want to practice along, pause the video in a few seconds, open up your web browser and the 2 web pages in a separate tab for each website. You can pause the Searcher in Charge videos whenever you want to practice something. Here is a search showing you how to open up 2 tabs using Internet Explorer. I have my 2 tabs already open, and you can see the Mayo Clinic on one and RYT Hospital on the other. How I did it is I went to File, and I looked for something called New Tab, and I clicked on it. If I click on the Mayo Clinic tab, I can see up in my address bar that it says mayoclinic.com. If I click on the RYT Hospital tab, I can see that it's going to say rythospital.com up in the address bar as well. And I can click back and forth between the 2 tabs. I can also add another tab sometimes by clicking to the right. Okay, here is an easy way to remember what to look for on a web page. CRAP. It stands for credible, recent, reliable, authority, and purpose. We will apply the CRAP test to one quality source and one that is not a quality source so you can see what to look for. Starting with C for credible, let's read the address for the web page as we learned in video 4 to make sure we know whose home we are in, see how professional they look, and if there is an About Me and Contact link. Remember, you can pause the video anytime and look at the websites in your browser. We see they both have an About link, can be contacted via email, and look pretty credible at this early point in our analysis. Even though the web pages both look good, guard against assuming that web pages with lots of logos, statistics, links to other materials, and navigation menus are automatic reasons to trust a website. Looks can be deceiving, so let's press on with our analysis. Because looks can be deceiving, another tool to help determine website credibility is DomainTools.com. They provide domain name ownership records. The domain name is like a name and address for a website. In the Who Is lookup search box, I typed the name of the 2 websites and used 2 separate tabs so I could have the information side by side. Here we see information from the Who Is record for each hospital. The first thing that stands out is the email search appears to be associated with the Mayo Clinic, yet not for the hospital. Moving down the page, we see the Mayo Foundation has a street address, the hospital a P.O. box. All of Mayo Foundation information is the same city, while the technical contact for a supposedly large hospital in New York is in Fort Lauderdale, and their administrative contact is a doctor. All this does not seem quite right. By calling the number listed for the admin contact, I found it was disconnected. This is enough information to find this website suspicious and probably not credible. The Site Profile tab will give you more information on a website to determine if it is credible. You would not do this with every website, but yet you can now when it is important. You can look at the websites after this video to finish out the CRAP review, and here's what to look for. The first R stands for recent. The Mayo Clinic has very recent information, and this is not found on the hospital site. Reliability means the information is verifiable by other sources, accurate, and reasonable with today's knowledge. The hospital lists head transplantation surgery, which is currently not a reasonable procedure. A is for authority, and the hospitals list many doctors with what appear to be impressive credentials. See what publications you can find by these doctors. If we try to find one for Dr. Elizabeth Pretner, we don't find any. Lastly, P stands for purpose. The hospital's purpose looks good, yet fails other parts of the CRAP test. Purpose also needs to be analyzed when viewing information from a company selling a specific product or service. Their purpose is to sell, and this may or may not be the unbiased information you need. You will need several sources of quality information with important health questions. You can use the CRAP test with all of your sources of information to help you find quality information. If it does not pass the CRAP test, move on. There are plenty of good sources out there. If stuck, contact your healthcare professional and/or librarian. Here is also a list of sources on analyzing websites if you want to see more examples of analyzing websites. Remember, you can pause the video. Lastly, in video 1, I spoke about the 3 sources of information: people, places, and things. So remember, with important health questions, your health care provider is a great source for your questions. Okay, here's what we learned today. Use the CRAP test to avoid non-quality sources. You need several sources of quality information with important health questions. Talk with your healthcare provider and/or librarian to find quality sources. And you can pause and replay any of the Searcher in Charge videos. This is Lark Birdsong of the Information Literacy Initiative at the University of Washington Information School, bringing you Searcher in Charge to help you learn how to find quality answers. See you on our next video.